Hello everyone, my name is Byung-Muk Lim and I'm a professor of School of Korean Medicine, Busan National University. I am very pleased to have an opportunity to introduce policies on Korean medicine. Korean medicine is a traditional medicine of Korea, and it is a collection of medical techniques and theories that have been used and developed over a long period of time on the Korean peninsula. The details of Korean medicine techniques and theories will be introduced in other lectures of this course. I will focus on the policy and management of Korean medicine, and I hope this lecture could help you understand the present status and roles of traditional Korean medicine in the modern healthcare system in Korea. This lecture will start with a brief history of the development of Korean medicine policy. And it will deal with Korean medicine resources, legal status, Korean medicine-based public services, research and development, and integration efforts of Eastern and Western medicine. As you might know, Korea was a colony of Japan from 1910 to 1945. During the colonial era, Korean medical system was reformed into Western medicine-oriented system. And Korean medicine lost the status of mainstream medicine. Korean medicine doctors who were working at the King's Palace, public hospitals, and military hospitals were driven out. By the regulation of physician that was enacted in 1914, Korean medicine doctors were degraded to medical apprentices position. Liberation from colony in 1945 gave Korean medicine a chance of revival. The Association of Korean Medicine Doctors was organized, and the private Eastern Medicine Institute, which maintained the Korean medicine education during the Japanese colonial period, was reorganized into a 4-year Dongyang College. Dongyang means Eastern, so it means Dongyang Eastern Medicine College. During the Korean War, in September 1951, a new National Medical Act was enacted, which regularized the licensing of Korean medicine doctors who were equivalent as Western medicine doctors. Korean medicine education in university and opening up Korean medicine clinics by Korean medicine doctors. There was a fierce controversy among lawmakers about the revival of Korean medicine system at the time. While some lawmakers argued that Korean medicine was an old-fashioned medicine and did not need to be regularly revived. Others argued that Korean medicine has been used by the people for a long time and should be revived and developed. Finally, Korean medicine was legally restored, and after that, South Korea has been maintaining a dual healthcare system where Western medicine doctors and Korean medicine doctors coexist. In 1964, the Dongyang Korean Medicine College was merged into Kyunghee University in Seoul, and from that time, Korean Medicine College education system was changed to 6-year courses, same with Western medicine education. And in 1973, the first Korean medicine hospital was approved and opened as an affiliated hospital of Kyunghee University. Korean healthcare system is mainly financed by national health insurance. Korean government implemented a pilot project for Korean medicine insurance coverage from 1984 to 1986. Based on the successful results of the 2-year pilot project, the cost of acupuncture, maxibustion, coughing, and herbal medicines were reimbursed in the national health insurance. And the number of patients using Korean medicine hospitals and clinics began to increase significantly. In 1989, Korean medicine doctors began to work as military doctors. And in 1993, very important event in the Korean medicine policy occurred, so-called herbal medicine dispute between Korean medicine doctors and Western pharmacists. Before we go to next slide, please see the pictures of wooden drug cabinet for herbal medicine and Korean medicine doctors gathering. This dispute was very important to understand the development of Korean medicine policies, so I want to explain brief background of the dispute. Herbal medicines have been the main source of income for Korean medicine doctors. And for several decades, some Western pharmacy-based pharmacists also prescribe and dispense herbal medicines. Maybe most of participants could not understand how pharmacists prescribe drugs, even it were herbal drugs. At the time, pharmacist of Korea was a kind of quasi-doctor. Prescribing and dispensing drugs were not divided between doctors and pharmacists. Some pharmacists earned money by prescribing and dispensing herbal medicines. So Korean medicine doctors had tried to ban pharmacists to provide herbal medicines and tried to monopolize herbal medicines. But in 1993, the then Minister of Health removed the one article in the Pharmaceutical Affairs Act. That article demanded pharmacists not to use traditional drug cabinet, but to use modern drug cabinet. Traditional drug cabinet is made of wood, and drug names are written in Chinese characters, as you saw in the previous slide. Korean medicine doctors argued that the article was kind of basis that the pharmacists were not able to handle the herbal medicines. So the deleted article should be restored again. On the other hand, pharmacists argued that the availability of the traditional drug cabinet was irrelevant to use of herbal medicines, and that herbal medicines could be handled by the pharmacist because it were also medicines. The issue of restoring the sentence of rule expanded to a controversy over the authority to prescribe and dispense herbal medicines between Korean medicine doctors and pharmacists. Korean medicine doctors and pharmacists closed their clinics and pharmacies in protest. And Korean medicine students and pharmacy students also took collective actions by refusing to attend the classes and take exams. The conflict lasted nearly a year. Even the government was not able to resolve it. An NGO called the Citizens Coalition for Economic Justice stepped in to mediate and succeeded to derive 3 points of final agreement. First, new herbal pharmacies shall be established to be in charge of herbal medicines production, distribution, and preparation. Second, existing pharmacists who want to provide herbal medicines shall pass an additional license examination for herbal medicines. Third, prescribing and dispensing herbal medicines shall be separated in the Korean medicine area. Based on this agreement, Department of Herbal Pharmacy was newly established to train herbal pharmacists, and 26,000 pharmacists received a license for herbal medicine preparation. Before this conflict, the number of pharmacists who handled herbal medicine was only 2,000. Korean medicine doctors started the struggle to stop 2,000 pharmacists' herbal provision. But this conflict gave legal license for herbal medicine to 26,000 pharmacists. Separation of prescribing and dispensing of herbal medicines were postponed on the premise that it would be implemented when conditions were formed. Instead, Pharmaceutical Affairs Act was revised to implement separation of prescribing and dispensing of Western drugs, which had been delayed for a long time. I think, ironically, most powerful result of the herbal medicine dispute was implementation of separation of prescribing and dispensing of Western drugs. These papers dealt on the herbal medicine dispute. The authors analyzed the dispute from a sociological point of view. Along the conflict of herbal medicines, Korean medicine doctors thought the cause of the dispute originated from the government's neglect of Korean medicine and strongly demanded the government to promote Korean medicine. The herbal dispute raised the status of Korean medicine to the public's interest, and aside from the solution of dispute, several promotion policies for Korean medicine were introduced. First, Office of Korean Medicine was established in 1993 and was expanded to the Bureau of Korean Medicine in 1996 within the Ministry of Health and Welfare. National Research Institute for Korean Medicine was built in 1994, and programs for supporting research and development on Korean medicine were introduced in 1997. Since 1999, Korean medicine doctors could also take part in the public health centers as public health doctors. And Korean medicine specialist system was introduced for the first time in the world. Let's take a look at the present status of Korean medicine in the modern healthcare system. The primary laws related to Korean medicine are Medical Services Act, Pharmaceutical Affairs Act, and the Act on the Promotion of Korean Medicine and Pharmaceuticals. The Medical Services Act regulates the definition and category of Korean medicine services, standards of the licensing of Korean medicine doctors, establishment of Korean medicine institutions, and the qualifications for Korean medicine specialists. And the Pharmaceutical Affairs Act regulates the definition and category of the herbal medicine, standards of herbal medicine concerning its production, distribution, and manufacture, and the role of authority of herbal medicine related to personnel. The Act on the Promotion of Korean Medicine and Pharmaceuticals was implemented in 2004 to foster the development of Korean medicine in a more systematic and stable manner. The enactment of an independent specialized law support traditional medicine was globally unprecedented at the time. The principal framework of the Act is, first, the government ministries come together every 5 years to establish and enforce a mid to long-term plan for the promoting Korean medicine. Second, research and development of Korean medicine should be supported and promoted. Third, the Korean medicine industry should be fostered. Fourth, quality control of herbal medicine should be enforced. This Promotion Act was amended several times. The second revision in 2011 was especially significant because the legal definition of Korean medicine was altered. The original phrase was Korean medicine and pharmaceutical should be defined as any medical treatment service based on Korean medicine that was traditionally handed down from the nation's ancestors and Korean medicine pharmaceuticals affairs. And it was changed to add scientifically applied and developed Korean medicine services to emphasize that the Korean medicine is an assembly of modern knowledge and technology, as well as traditional inheritance. This table shows that Korean medicine now shares an almost equal legal status with Western medicine. Korean medicine has formal education and licensing system. There are government bodies and funding on Korean medicine. Korean medicine participates in the military and public health sectors. Korean medicine procedures are reimbursed by National Health Insurance. And there is official positions for the presidential physician of Korean medicine. However, there are differences in the use of medical devices and drugs that Korean medicine doctors are prohibited from the use of Western drugs and modern medical devices. There is currently a conflict between Korean medical doctors and Western medicine doctors regarding the partial use of modern medical devices by Korean medicine doctors. Legally, the use of acupuncture is permitted only to Korean medicine doctors and not to Western medicine doctors. Authority for the prescription of drug is also mutually exclusive between Korean medicine doctors and Western doctors. Based on the Act on the Promotion of Korean Medicine and Pharmaceuticals, the government is obliged to set up a mid to long-term plan to foster Korean medicine every 5 years. Korean government implemented the first 5-year plan from 2006 to 2010, the second from 2011 to 2015, and the third from 2016 to 2020. The third plan was established through the participation of 7 ministries, including the Ministry of Health and Welfare, Ministry of Education, Ministry of Science and Technology, and Ministry of Food and Drug Safety, etc. The plan contains strategies and tasks to improve the quality of Korean medicine services and herbal medicine, and to foster the Korean medicine industry over 5 years. In the third plan, 4 major objectives were determined. First, enhancing scientific evidence and raising the public credibility. Second, enhancing accessibility to Korean medicine through expansion of health insurance coverage and public service. Third, promoting Korean medicine industry by technology innovation and conversion. And fourth, establishing advanced infrastructure and enhancing the international competitiveness. In 1993, the Division of Korean Medicine was installed temporarily under the Bureau of Medical Policy in the Ministry of Health and Social Affairs. The division was subsequently elevated to the status of the bureau level, the Office of the Director General for Korean Medicine, with the Division of Korean Medicine Policy and the Division of Korean Medicine Industry. Division of Korean Medicine Policy manages laws on Korean medicine and pharmaceutics, human resources in Korean medicine, support for Korean medicine-related corporations and organizations, paramedics such as acupuncturists, maxillary and bone settlers, Korean medicine health promotion and Korean medicine public health projects, and international cooperation on Korean medicine. Division of Korean medicine industry manages R&D support for Korean medicine, support and nurturing of the Korean medicine industry, and supply and distribution of good quality medicinal plants, etc. Under the Ministry of Food and Drug Safety, there is a division for herbal medicine policy, which administers policies for herbal medicine materials and herbal preparations. The Division of Herbal Medicine Research was established under the National Institute of Food and Drug Safety Evaluation for technical support on the safety management of herbal medicine and herbal products. In 2018, Korea's healthcare workforce includes 25,000 Korean medicine doctors, 103,000 Western medicine doctors. There are 5 times as many Western doctors than Korean medicine doctors. And there are more than 3,000 hospitals and 30,000 clinics in Western medicine, and 300 Korean medicine hospitals and 14,000 Korean medicine clinics. Among the number of hospitals, there are 1,500 long-term care hospitals in Korea. Long-term care hospitals can be owned and managed by Korean medicine doctors as well. This table shows the number of Korean medicine-related personnel. There are 2,500 herbal pharmacists, 25,000 herbal dispensary pharmacists, 760 herbal medicine apothecaries. Herbal pharmacists are those who graduated from the Department of Herbal Pharmacy and professionally maintained and dispense herbal medicines. Western pharmacists for herbal medicine are Western pharmacists who obtained an additional license to dispense herbal medicines after herbal medicine dispute. Herbal medicine apothecaries are not considered to be a part of healthcare and may only distribute, mix, and sell herbal medicines. But conventionally, they have prescribed and dispensed herbal medicines like Korean medicine doctors. There has been no more new herbal medicine apothecary since 1983. The number of dual license holders who have both Western medicine and Korean medicine license is slightly increasing. To be a dual license holder, Korean medicine doctor have to graduate Western Medicine College and pass national examination. And Western medicine doctors have to graduate Korean Medicine College and pass national examination. By 2018, there were 300 Korean medicine hospitals and 14,000 Korean medicine clinics. Over the past 10 years, there was a 100% increase in Korean medicine hospitals and a 30% increase in Korean medicine clinics. One of the unique properties of the Korean medicine system is the system of Korean medicine specialists. The Korean medicine specialist system was initiated in 2000 for the first time in the world to improve and specialize the Korean medicine service. To qualify as a Korean medicine specialist, Korean medicine doctors must get training for 1-year internship and 3-year residence course at the designated hospitals. After completing the residence training, licenses are issued upon passing the qualification exam. The Association of Korean Medicine governs the qualification examination by delegation from the Ministry of Health and Welfare. There are 8 areas for specialization in Korean medicine, including internal medicine, pediatrics, gynecology, psychiatry, acupuncture and moxibustion, eye, ENT, and dermatology. In Korean medicine, these three areas are combined. And we have rehabilitation medicine and Sasang constitutional medicine. Sasang constitutional medicine is a medical tradition that studies the physiological and pathological traits of the four constitutional types, namely the Taeyang, Soyang, Taeum, and Soum. The principle of Sasang medicine treatment is based on the reinforcement of the hyperactive visceral groups. Thus, medicinal herbs of Sasang medicine are divided into four groups that correspond to the four constitutions. Under this rule, medicinal herbs and herbal remedies belong to a certain constitution cannot be used for others. Otherwise, this can result in no effect or an adverse effect. As of 2018, about 3,000 Korean medicine specialists were qualified. Korean medicine internal specialists were the largest in number, with 1,000 specialists, followed by 600 specialists in acupuncture medicine. The Korean medicine specialist system stimulated the professional development of the 8 specialties and improvement in medical service in Korean medicine hospitals. In a nationwide survey performed in 2014 for 5,000 South Koreans over the age of 20, 92% of respondents had experienced Korean medicine services in their lifetime. 27% had used an outpatient service in Korean medicine hospitals or clinics in the past 3 months. And 0.8% had been hospitalized in Korean medicine hospitals in the past year. Usage of Korean medicine hospitals and clinics increased in comparison to the previous year. According to the National Health Insurance statistics, the number of claims made by Korean medicine hospitals and clinics per year was about 900,000 in 2009. The number increased to 140 million in 2014 and has been maintained since then, exceeding 100 million. The number of claims accounts for about 7.5% of total number of claims by all healthcare institutions and pharmacies. In 1989, Korean medicine military doctor system was introduced. Korean medicine military doctors are selected from among Korean medicine specialists and appointed as lieutenants after a certain military education. Since 1998, Korean medicine public health doctors have been allocated at the public health centers and branches in each city, county, and district across the country, providing Korean medicine treatments and health promotion services. As of 2018, 254 public health centers provided Korean medicine services and also provide regular visiting healthcare services for senile patients who have difficulties in ambulation. Including public health doctors and employed doctors, 304 Korean medicine doctors were working at the public health centers and 700 public health sub-centers. Research of Korean medicine has been conducted at universities since the 1970s. But the government started a systematic R&D investment for Korean medicine in 1994, when the Korean Institute of Oriental Medicine was opened. And it was expanded in 1996 as the Ministry of Health and Welfare firstly launched the research project on the development of Korean medicine. From 2004, the Korea Institute of Oriental Medicine began to receive large-scale research budgets from the Ministry of Science and ICT. And the investments from the Ministry of Trade, Industry and Energy and the Ministry of Food and Drug Safety also increased. The government's Korean medicine R&D budget in 2018 was about $103.5 million, accounting for about 0.6% of government's R&D investment budget of $164.8 billion US dollar, and about 7.8% of the healthcare R&D budget. As of 2018, the Ministry of Science and ICT is investing the most, with 63.6% of total government Korean medicine research funding, followed by the Ministry of Health and Welfare, the Ministry of Education, and the Ministry of Food and Drug Safety. The Ministry of Science and ICT mainly supports basic research and original technology development. And the Ministry of Health and Welfare is supporting clinical research and cooperative research between Korean medicine and Western medicine. Lastly, I will explain Korean medicine-Western medicine collaboration policies. Korean medicine hospitals usually care for both inpatient and outpatient, with the majority of inpatient consisting of musculoskeletal, cerebrovascular, and neurological patients. To manage inpatients, Western medical diagnostic tools and drugs, in addition to the Korean medicine diagnosis and treatment method, are used. For this, most Korean medicine hospitals have additionally included Western clinics or employ medical doctors. Before 2011, due to the legal restrictions, Korean medicine hospitals had previously installed separate Western medicine clinic while actually performing co-practices internally. But as the Medical Services Act was amended in 2011 to promote Korean Western medicine cooperatives, Korean medicine hospitals were given authority to directly employ Western and medical doctors or internally install Western medicine clinics. Of course, Western hospitals can also directly employ Korean medicine doctors or install Korean medicine departments. Korean government recommended both Korean medicine school and Western medicine schools to produce dual license holders. Dual license holders are expected to play a certain role to mediate and connect Korean medicine and Western medicine. Early 2000, medical schools had 4+4 education system. In this system, schools received graduate students from college and provide 4-year medical course training. At the time, all medical schools provided special favor for Korean medicine doctors who want to admit medical schools. And Korean medical schools also did for Western medical doctors. Thank you for watching this lecture. If you have any questions or comment, please feel free to contact me. Thank you.